Today, I had a conversation about chronic illness, what it really takes to heal from chronic illness or get better from it, and what are the culprits of chronic illness? Is it food dyes? Is it seed oils? Is it vaccines or shots or medications? Is it the food that we're eating or the pesticides? Is it the chemtrails? Although we didn't talk about chemtrails, but is it a lot of all of this that is impacting us? Are we more genetically susceptible? What is it that is causing autism and a lot of these other children or childhood illnesses? I now eat a lot of meat, and so do they. If you want to thrive, you need to eat meat. Meat is required. Hey guys, my name is Judy Cho and I'm board certified in holistic nutrition, and I have a private functional medicine practice where we focus on root cause healing, and that often starts with the Carnivore Cures all meat elimination diet. Today, I had the pleasure of sitting down with Dr. New. Dr. New is a medical doctor, an integrative medicine doctor, and he shares a lot about chronic illness, how he focuses on chronic illness and getting people to root cause healing. He now focuses on children illnesses or childhood illnesses, what causes autism, gut issues, autoimmune, type 2 diabetes, type 1 diabetes, and all of the bucket of illnesses that now seem to be plaguing our children. Dr. New talks about all of the different factors of what causes illness, what may be contributing to chronic illness, and if it's even one thing or many things. We talk about then how do we support chronic illness, and if we have had adverse health outcomes from either COVID or getting the virus, or if you have had the COVID vaccine. What are some of the protocols or steps that we can take to start healing ourselves or detoxing ourselves from the spike protein? Or is it even the spike protein that we need to be detoxing? We get into a lot of the nuance and the next steps in trying to find answers. And it's more of a conversation than this is the answer. And I hope from this conversation, some light bulbs go off for you or answers for your practice so you can get closer to root cause healing for you or your patients. Let's get right into the interview. Hi, Dr. New. I'm so excited to have you on my channel. For the people that may not have heard of you, if you can introduce yourself to the people that are listening and watching.
Sure. Yeah. Dr. New is very short for James Robert Neuenschwander, comma, MD. So I don't want to say Neuenschwander all day long. So everybody calls me New or Dr. New, which is what I've been my entire life. So I'm actually a graduate of the University of Michigan a long time ago, before most of y'all were born. So I graduated medical school in 1985. I went to medical school originally thinking they were going to teach me how to cure people, how to cure disease. That's actually why I went. And obviously, they don't teach you that. I ended up in a surgery residency because it was cool. It was fun. You're actually removing disease from people. So that kind of made sense to me. But in the middle of my residency, I sort of had an epiphany when my ex-wife had some health issues. She went to, a friend of her told her to go see an herbalist. She goes to see this naturopath and puts her on herbs and homeopathics and acupuncture. And, we're changing how we eat and we're doing this and that. And it's like, yeah, whatever. But like she got better in a month. I mean, these were chronic health conditions that got significantly better in a month. And that kind of woke me up. From that, I learned acupuncture, I learned homeopathy, I learned herbal medicine, and actually left my surgical residency to pursue a career in naturopathic medicine. Now, this was a time before I think Bastyr was the only naturopathic medical school at that time. So I was basically self-taught. Started my clinic in 1988 and started with adults originally. Had a very thriving clinic by the late 1990s, early 2000s, when my current wife had a friend that had a child on the autism spectrum, said, "How's your son doing?" And she said, "Oh, we've been able to recover him." And that sort of set her like, I didn't know you could recover from a psychiatric disorder. And she said, "Oh, what did you do?" "Oh, we did methyl B12 shots. We did the gluten casein-free diet. We did some detox." And she's thinking, New does all that stuff. And she came home, said, "We're saving the babies," dragged me kicking and streaming into the world of autism. And the thing about it, at that time, there was a group called Defeat Autism Now, or DAN. And she took me to one of their conferences and I just fell in love with it because it was all about the biochemistry. This is why I got into medicine in the first place, understanding why people get sick and what to do about it. And they taught us that for these kids that had autism, and it's expanded to any chronic disease. So that was very helpful. From that, Dan fell apart in the late 2000s. MAPS, which is the Medical Academy of Pediatrics and Special Needs, was started in 2012. So I was a member from the beginning, one of their first fellows. I'm now the president of MAPS. We're trying to sort of create that community. And the thing about all this is my practice has always been about treating chronic illness. Now it started treating chronic illness with adults, and then it was like, oh, can you see my kid? I don't really see kids, but sure. I'm board. I was retired board certified emergency room physician. That one was retired as of January 1st. But so I'm qualified to see kids and realized that again, there's so many kids now that have these chronic illnesses, and that's really what MAPS is about. And we've really been pushing to say we should be the voice of pediatrics because we understand the causes of diseases and we understand how to help these children heal, not just which pharmaceutical for which symptom we should be prescribing, which is what not just pediatrics, that's what all medicine has become, right? Symptom pharmaceutical. So that's where I'm at now. We met at a wonderful conference, the Forum for Integrative Medicine, TFIM, and that's how I got here, as we like to say.
Thank you. Thank you for that introduction. Let me foray into the whole children's health space then. Obviously, there's a lot more illness and chronic illness happening and occurring with the children. Now there's diabetes or type 2 diabetes, where it used to be adult onset and now it's in children. Children also get fatty liver. Obviously, there's might be heavy metals. Maybe it's related to all the shots we're giving. And then autism, ADHD. Some people say, well, these all existed, but it's just now that we're diagnosing. What have you seen in your career? And what do you think are the big culprits for these
Well,
illnesses?
I mean, let's start with autism.
Okay.
I went to medical school at the University of Michigan. It's a large tertiary care center, 1981 to 1985. That was my medical school. And then 3 more years in surgical residency. So 7 years at a large tertiary care referral center. I did not see one case of autism the entire time I was there. All right. I went to a high school with 1,500 kids, graduated in 1978. We had a special ed room. Those kids, none of those, they had Downs and they had cerebral palsy. None of those kids had autism. Now I can't go to a grocery store or a big box store or a stadium without seeing a kid that's on the spectrum. So I like to say if it went from 1 in 10,000 to 1 in 31, and it's because of better diagnosis, I want my money back from U of M because they didn't teach me how to diagnose autism. All right. And even if you say, oh, they loosened up the diagnostic criteria, which they did,
Right.
they've been tracking this for the last 20 years. You can see the rate of autism going up every time they announce the rates. So if it was better diagnosis, we should have seen this big jump when they changed the diagnostic criteria. It ain't there. All right. It's just this linear line from 1992 to now. Well, that's more than 20 years. It's just a straight line that's been going up they announce the rates every 2 years. Well, they measure it every 2 years. They don't announce it every 2 years, but it's every 2 years we know where it's at. So the most recent numbers, these are kids born in 2014. We have no idea what the autism rate is if you were born today, but these are kids born in 2014. The rate was 1 in 31. Again, if you go from 1 in 10,000 to 1 in 31, that's a 31,000% increase in the rate of autism. You can't tell me that's from better diagnosis, right? And it's the same. What about things like asthma? Are we better at diagnosing asthma? Are we better at diagnosing type 1 diabetes? Are we better diagnosing what we used to call adult onset diabetes, type 2 diabetes? Are we better at diagnosing rheumatoid arthritis, juvenile rheumatoid arthritis? I mean, give me a break. So most of us believe chronic illness is from some type of toxic insult to a system that can't detox very well. And we know this with kids on the autism spectrum. They don't detox worth a damn. And again, we went from, we can get into vaccines, but we went from when I was a kid, we got a DT or a DPT vaccine and we got an oral polio. That was it. We didn't have measles. I was born in 1960. We didn't have the measles shot. We didn't have everything that they had. And they had already at that point, most doctors were not administering smallpox shots when I was born, although plenty of people my age got vaccinated for smallpox. But we just don't have what we have now. I like to say we have to deal with lead and mercury. piece of cake. Now we have to deal with PFAS and we have to deal with these, forever compounds that nobody knows how to detoxify. I can give you chelation to detox your lead and mercury. You walk in with PFAS, I have no idea what to do, right? I can put you on binders, but they don't work very well,
Right.
right? And so that's where we're at now, where you have this toxic environment. It's fed by the, food, water, air, all the crap they add to our food, but also how we farm, the stuff, the residues of that farming process in our foods. Again, I believe vaccines play a role in a lot of these chronic illnesses. It's just, that's the third rail of medicine. You can't talk about that. So we don't have great data on it. But, you can't take care of autistic kids for more than a day and not hear a story of a parent saying he was okay until this or that vaccine. And I'm not blaming one vaccine because I don't think it's, MMR, it's DPT, or it's whatever. I think it's the general concept of toxicity, and that's the one toxin we're injecting into kids, and especially babies and kids less than a year old. Their detox systems are not well developed. They're not designed to be exposed to that stuff. So.
Right. I think I heard something where the amount of aluminum or the amount of mercury in one shot may be under the amounts that are considered quote unquote safe. But when then you add all of the multiples that you're then putting in the body, how much is it really safe? And that's
Well, let me tell you a dirty little secret,
okay.
okay, about injectable aluminum adjuvants. This is not drinking aluminum or breathing aluminum or even running aluminum intravenously. This is injecting an aluminum adjuvant into a muscle.
Okay.
So the dirty little secret is we've been doing this since 1920.
Mhm.
The dirty little secret is that has never, the pharmacokinetics of that, of injected aluminum has never been studied in humans, ever. All right. Number two, it had been studied in animals, but it was like four guinea pigs. I mean, it's unbelievable when you try and I'll challenge anybody, show me the study, because when you dig down into the safety of aluminum injected the way we use it, nobody studied it. We don't even know how long it takes to get rid of. And the reason why this is important, if you inhale it, it gets into your bloodstream, your kidneys will probably clear it. If you eat it, definitely your body will clear it pretty rapidly. But when you inject it into the muscle, it's picked up by our macrophages, by our antigen presenting cells. They suck the stuff up. How long does it stay in that macrophage? Well, as far as we know, as long as that macrophage is alive. So how long is that? 6 months, 2 years? We don't know, right? And then wherever that macrophage goes, the aluminum goes along with it, right? And so we're, because the American Academy of Pediatrics saying is, there's more aluminum in one bottle of formula than there is in the entire vaccine schedule. To which I would reply, you might want to clean up your formula, but the second thing is, it's not the same. You
Right.
know, it's a completely different compound. So, and we're back in this state of vaccines are a religion. We can't question them. I'm saying there's no Jesus, there's no God. Nobody will allow us to investigate it because as soon as you do, you're ostracized, you're defunded, you're a quack, you're, investigated by your medical board. All that stuff happens because the fear is if somebody puts even a little chink in the armor of, vaccines are safe and protect and effective, then everything will fall apart. Everybody will stop vaccinating and we'll all die of polio. That's the fear. And yet, how do we know what price we're paying?
Right.
How do we know that all the increase in chronic disease isn't from that? Or from a food coloring, or from atrazine, or all these chemicals that everybody else has banned and we haven't. How do we know what it's from? Unless you study it. And we
Right.
can't. I mean, you can study food additives now. You can't study vaccines and say anything negative and even get the article published, much less what it does to your reputation. But even getting the article published, right? And so that's scary because how can you have science when you can't investigate things? And that's been the frustration for us for a long time. But the bottom line for us is like, I'm not going to get into politics of that stuff because that's not who I am, right? What I want to know is what created the problem that I'm seeing sitting in front of me, and what can we do about it?
What about mercury adjuvant? So the thimerosal is it the same type of lack of testing as well? And is it similar so a lot of people will say, hey, I eat tuna and there's mercury in it, and that's why now I'm flooded with mercury in my system, so I'm going to just stop tuna. But how much could it have been any of the adjuvants?
Yeah, well, the issue with thimerosal in the vaccines is it would have been really nice if we had thimerosal in vaccines and then we had no thimerosal in vaccines.
Okay, okay.
That never happened. We had
Okay.
thimerosal in vaccines, then they voluntarily removed the thimerosal from the vaccines, and they're still in some
Right,
vaccines, and you
right.
still have traces, right? So technically it's not gone, but it wasn't, we're going to stop today and then see what happens. And of course, when you have this and you have the rates going like this, you don't see the benefit
Right.
because, you could say, well, they got rid of thimerosal in 2001 or 2002, whatever the year was. We should have seen a big drop in autism. We actually saw a little bit of flattening, but we didn't see a drop. And again, it's because it was voluntary and for whatever was on the shelves was still available. So the new stuff was thimerosal free, but what people had wasn't. And really, for a long time, it was, for Medicaid patients, low income, that's where the thimerosal vaccines went. And people don't talk about that, but that's part of the history of all this stuff. But, so again, it's whether you could even make a vaccine that doesn't inherently create problems, because most of these vaccines have to have something in them to stimulate the immune system. Thimerosal was considered a preservative, but it was also an adjuvant.
Mm.
So it did stimulate an immune response. Aluminum is there absolutely as an adjuvant, right? So without it, the vaccine wouldn't work. So you'd have a safer vaccine, but you'd have an ineffective vaccine. So, they're not that excited to change it. We have newer adjuvants, but there's not a whole lot of evidence that they're necessarily safer. And in fact, they may be more aggressive because part of it too is you're stimulating an immune system. A lot of kids that are on the spectrum, a lot of kids that have these autoimmune, if you look at the rise in chronic disease in kids, it's almost all immune system based,
Right.
right? So if you overactivate an immune system that's already overactivated with your adjuvant, then you're off to the races with whatever, degenerative disorders, inflammatory disorders, allergies, autoimmune disorders. And autism is basically, for most kids, autoimmune inflammation of the brain. That's what autism is, right? At least 70%. So, you're looking at a situation where even if you cleaned it up and replaced the aluminum with something else, and this is what we need to be careful of, because if you're going to name a villain, the villain is aluminum. And then you better be prepared because they can pull that out and put something worse in there.
Right.
It's
Right.
like, see, it didn't make a difference. We got rid of aluminum and nothing changed. Yeah, because you put something more toxic in there. So we have to be careful about, because again, people say, do vaccines cause autism? And I'll say vaccines can cause autism. If you're going to ask me, are vaccines the cause of autism? I'm going to say no. I have completely unvaccinated kids that have autism, so I can't say that just based on what I see in my practice. But vaccines are the one, I think toxins cause autism, but vaccines are the one toxin we inject, right?
Right.
Right? We don't inject atrazine. We don't inject red dye number two, hopefully. You know, that's all ingested. And anything we eat goes through our liver first and all the detox pathways we have in our liver before it gets into our bloodstream. Whereas what we inject gets picked up directly by the immune system right from the site of injection.
I love that you brought up that we have to be aware of the villainization of one thing, because I do see that a lot in the wellness space of it is just the seed oils, it is just the food coloring. And I think what people fail to see is, for example, BPA was villainized, and so now they use BPS or BPT, and they're not that different. They're the and so now they all the advertisements say BPA free, but they still use some type of derivative of that, and it's still super toxic. And then even with the food coloring, so I'm glad that now they're starting to remove or they're going to remove these artificial food dyes, but the natural food dyes, there's not a lot of studies. They might still have toxins. So I love that you brought it up, because we also see in our practice, we work with chronically ill, it's more of the adults, but it's a mesh of everything. And it's just figuring out what is the biggest Achilles heel to go after. Is it more of the heavy metals? Is it mold? Is it Lyme? But it's not usually this is the one thing. And so when I see that, it's always a red flag, because you're not seeing the bigger picture of chronic illness. And if you just go after, sure, they could remove all linoleic acid or seed oils, but I know in our practice that is not the root cause of all illnesses. I really wish it was, because then it'd be super easy, but it's
Easy.
not, right? And so I'm curious with you, with your population. It's I love that you shared that you have autistic children that are not, they were not vaccinated. So is there a big lever? And maybe there is, but mold, Lyme, other immune system, the food, the processed foods, the atrazine, the vaccines. Is there one that you've seen as a big heavy hitter? Hey guys, just a really quick break. Nutrition with Judy's private practice is now called Empower Functional Health. I started as a nutritional therapist, but we have become much more all encompassing. At Empower Functional Health, we do functional medicine, chronic illness, autoimmune, gut health, environmental illness such as CIRS, mold illness, Lyme. Regardless of all these names, the goal for us is always to get you root cause healing answers. And of course, carnivore, the all meat elimination diet is always on the table. Food, the right food, is always medicine. We offer functional tests, prescription meds, and really everything to get you closer to root cause, where you can just eat the meats you enjoy and live the life that you are meant to symptom-free. The goal is to get off meds, supplements, and everything else that your body no longer needs support in. Our practice, whether it's Nutrition with Judy, sharing podcasts and free content, or our private practice, Empower Functional Health, our goal is to support you guys in the barbell theory. We give a lot of free content, our evidence-based research. We don't use Substack. We give all our stuff away for free. We interview with the best and make it super tactical, so you have clinical pearls that you can walk away with and try in your own healing journey. And then we work with some people in a smaller subset, one-on-one, to provide that level of personalized care. And as we heal these people that are chronically ill, we find these clinical pearls and golden nuggets that we can share then more publicly, so that we can make wellness for all. Hopefully, the content and the guides and the free stuff we give out is enough for you to heal. But if it's not, you can always come and work with us in our private practice so that you can get more personalized care. If you want to learn more, make sure to check out empowerfunctionalhealth.com.
Yes. Look, I mean, that's why I don't ever want to be to say in my journey, right? So I started with chronically ill patients, and when I started in the late 80s, I mean, basically, if you chelated people, I'm talking IV, EDTA, chelation, everybody was lead toxic. You got wonderful results, right? Because we grew up, I mean, I grew up eating lead. I mean, literally, we had lead sinkers in our fishing tackle box. We would melt them with a plumber's torch in the basement and pour it into little sand molds. My mom freaked out. I couldn't figure out why she was so upset we were doing that. But, and then everybody played with mercury. It was fun. It was cool, so we were all toxic. So when you detox people, they got better. But one of the first things I started treating was Lyme. Right. So, I live in Michigan, and Michigan to this day, there is this delusion there's no Lyme in Michigan.
Right.
There's Lyme in Ohio, Indiana, Illinois, Wisconsin, Minnesota, but not Michigan. The ticks come up to the border and go, oh no, I can't go there. But so, I started with that. And, you'd have these great results in some people and no results in other people. Right. And from that, it was like, oh, mold toxins. So all I knew about mold was allergies, and mold toxins were the next thing. It's like, I live in Michigan. All right. So it's not a question of do you have mold in your house? It's a matter of how much and which ones. Right. You got mold in your house. I'll save you a lot of money if that's the question. All right. So, it went to, oh, we have to detox the mold. And then it's, so we go from detoxing heavy metals to detoxing the mold. And then I start taking care of kids on the spectrum. And it's like vaccines. Oh, okay. How do you detox a vaccine? Oh, there's aluminum in the vaccine. There's formaldehyde. There's, the polysorbate 80. There's, all these excipients that we don't know about, residues of antibiotics, all this stuff. Well, now we're talking general detox. Oh, okay. Well, and all along we were always working on the gut and gut health and eating right food and all that sort of stuff. And by the way, this is my answer to seed oils. It's not a matter of don't eat seed oils. Don't eat crap. That's my advice.
Agreed.
Eat real food.
Yes.
All right. And if you're going to eat an oil, eat something that came out of an oil press. That's very simple. All right. You're not going to find a corn oil press. You're not going to find, I mean, you got to take olives and press them. You'll get oil out of that.
Right.
Right. So, it's eat real food that you make that, preferably organic. If you can't afford organic, learn about the dirty dozen. Do
Yes.
not eat those unless they're organic. If you want a strawberry and it's not organic, oh well, not today. All right. So this idea of detoxification came out of that. So really, Lyme, you're detoxifying an organism, but it's not really the organism, it's your immune system's response to the organism. I mean, that's always what causes disease, right? Louis Pasteur, bugs cause disease. He was close. It was a reaction that you have to the bug that causes the disease. So then you have to deal with why is this system more reactive than this system? Because early on I measured my antibodies to Borrelia, the Lyme spirochete, and I was CDC positive on my long-term antibodies, right? So I've had Lyme at some point in my life, but I don't have Lyme disease, right? So, what's the difference between me and this person sitting in my office who has fewer markers than I do, but they're just horrible? I mean, they can't get out of bed, they're chronically ill, they have all these symptoms of an infection, right? What's the difference between those two? Well, maybe it's the 2.5 years of chelation I did to get my lead level under 5, or my mercury level, and, getting rid of my fillings and all the things that I did to detox. Maybe that's the difference, right? So, when you talk about Lyme or mold or, metals, right, it's all the same conversation.
Right.
It's just which tools are you using? Are we using chelation? Are we using antibiotics or antibiotic herbs? Are we using immune stimulators? Are we using, something to help with the gut detox? Are we working on mold in the house? What mechanism of detox? And Sid Baker, who was, one of the godfathers of functional medicine. He's in his late 80s now, but he was a pediatrician, and his thing was always, have we done everything we can for this child? And you can just say for this patient. But I remember spending some time with him in an Uber, and I just went, well, I have this brilliant mind right here. I'm just going to tell him about my most complex patient that I have no idea what to do. So I spend the next 20 minutes going through this detailed history and all the testing I did and all the things we tried and blah, 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 blah. And I go, what should I do, Sid? And he just looks at me and goes, detox. So it's like that's what it's all about, right? So, regardless of what you're saying you're treating, at the end of the day, what you're trying to do, and I really believe this, you're trying to get the body to do what it was designed to do in the first place, right? I always say we don't have to push people into health. We have to remove the barriers that are stopping them from getting there. Your job and my job is to figure out what those barriers are and how we can treat them. So if the barrier is a Lyme spirochete, or more importantly, a Lyme co-infection, or it's a mold toxin, or it's a heavy metal, or it's an industrial chemical, or it's a food dye, then that's what we need to do. Right. And the whole thing with the seed oils, it just adds another brick to the load or another log to the fire. It's rare that that is the cause unless you actually have like an allergy or a hypersensitivity to it.
Right.
I'm not saying I'm a fan of seed oils. I tell all my patients, have for many, many years, getting rid of seeds is a really good thing. I'm not just talking seed oils, I'm talking seeds is
Right.
a really good thing if you have an immune system hyperactivation. It's just so many people have sensitivity to one or more things in that category, whether it's gluten or it's corn or it's soy or it's peanuts or, whatever it might be, that just eliminate the whole family, see how you feel. And then if you really miss your corn, well, add it back in and see what happens.
Yeah, it's a lot of common sense. I will tell you that we oftentimes start with the elimination diet as fundamental tool. Not everyone wants to go that strict initially, but generally that's our recommendation. And then we can see what level is your immune system reacting to your foods. And I will tell you that we have never had one client or patient that the root cause was just seed oils, like zero.
I
So,
agree. I agree with you.
and,
No,
and
you should be able to tolerate some crap. So that was
Agreed. I think our immune system is smarter. So, but going into that question about the immune system, how do you find that balance of if somebody is positive for Lyme and then mold and they're now you see that they're having mast cell responses, they're probably not the candidates that should be getting vaccines because their immune system will overreact. So while we're starting to treat all of these areas, but we also want to make sure that we're strengthening the immune system and not just nuking everything as well. How do you find that balance to ensure that while we're supporting your body, while we're detoxing and getting stuff out, maybe using binders, chelators, whatever the thing is, but also strengthening the body with obviously diet and things, but how do we make sure to get that balance so that we're not just again nuking the body?
Yeah, I mean, I think the key thing is following what's going on in the gut biome. I mean,
Okay.
that's always been such a huge part of what we've done from day one, right? So, if you're because people are extremely different in how they handle this stuff, and I'll just use an extreme example of antibiotics. Now, I mean, antibiotics for Lyme. An acute case of Lyme, I think they're maybe 30 or 40% effective. It's really pathetic. I'm talking like you have the bullseye, and a month of doxycycline has a 30 or 40% chance of clearing it.
Okay.
If you
Interesting.
have chronic Lyme, it's less than 10%.
Right,
And
right.
that's what everybody wants to use. And, when I first went to conferences, and it was mainly an East Coast, West Coast thing, the East Coast doctors are, you need more, stronger, heavier, IV, blah, blah, blah. And the West Coast was like, don't even waste your time. Oh, then the answer is not antibiotics. And the answer is somewhere in between because I have had patients because I still prescribe antibiotics. I mean, I take heat all the time for that. But I prescribe them as a trial to see what it does to the patient because I've cured people with chronic Lyme with antibiotics. I've,
Okay.
I've done it many times. All right. So I don't want to take that off the table because I'm philosophically against, because to me, an antibiotic is another toxin. Right.
Sure,
So,
sure.
but I'm
Agree.
going to do a whole bunch of stuff to help maintain that gut ecosystem because that determines whether or not they can handle that antibiotic. Right. If we can maintain some semblance of what that ecosystem should be like for that person while we're treating, then we have a chance of using an antibiotic. If we use an antibiotic and it just blows that up, then we're not using an antibiotic because the damage that you're causing by the antibiotic far exceeds any benefit you could even possibly hope for, right?
Okay.
This is not just prescription antibiotics, it's antiseptic herbs too.
Sure.
Just because it's an herb doesn't mean it's without side effects and consequences and toxicity and all that stuff. You know, so again, you want to make sure that whatever it is you're doing, you're not disrupting that side of the equation. So, nobody comes in with chronic Lyme and I just say, here's a prescription for some doxycycline and some, hydroxychloroquine. Have a nice day. We'll see you in a couple months and see where things are at. Right. It's always going to be, okay, well, if we're going to do that, okay, here's that. And then here's these fibers to try and support the bacteria that we're about to knock out. Here's one of these, soil-based probiotic organisms that's going to help maintain an ecosystem. Here's one of these soil-based supplements that just provides some of those compounds that help maintain the equilibrium in the gut. Maybe we need to do something for glutathione, maybe we need to do something for vitamin C and all this stuff. There's going to be other things that go along with it. And the question is, well, how does that treat my Lyme? It doesn't. It treats your system,
Right.
right? And gets it to a place. Because I always tell people, if I had my magic wand, I could just tap your immune system on the head, and the problem would be gone tomorrow, right? I mean, we've been living well. Dr. Bergdorfer of Borrelia burgdorferi fame did say we dropped tick bombs and did
Right.
actual bioengineering on that one,
Right. I
which I
know.
thought it was garbage until I heard that guy actually say, I went, okay, maybe we do have a problem here. But in most of the world, you go to Scandinavia, 20% of people have antibodies to Lyme. I mean, again, CDC positive Lyme tests. They don't have Lyme disease. They just, it's so common there that people get it, get over it, become immune to it. It doesn't cause the problems we have here. So, it might be an altered organism, which sounds like that's possible, but the big thing is, what is your system doing? How is your immune system responding? If we needed to respond here and you respond here, then you die of infection. If we needed
Right.
to respond here and you respond here, now you have a chronic inflammatory syndrome, autoimmunity, and you're miserable, and we say you have Lyme disease. We
Got it.
needed to respond here. All right.
And the best chance is obviously strengthening the immune system, strengthening the gut and the microbes in it.
Yep.
I'm curious with autism. So, what is the standard conventional care for somebody that's on the spectrum? And then, because I know that there are parents that will I went into a forum because I was really interested in it. And some of the parents were saying, I put my kids on meds all day and then they become hyper reactive at night. So they feed them coffee and Mountain Dew to sedate them. And I remember just being shocked and I never really looked a ton more into it. I guess like what's the standard care model? I guess maybe for a general case, and then do you see people or children that no longer fit the diagnostic criteria from the holistic care?
Yeah. So, I mean, this is the other great tragedy of autism. There are no FDA approved drugs to treat autism. None.
Okay.
Zero. After having basically epidemic numbers for decades, there's nothing. All right.
Okay.
So, and even drugs that had potential were poo-pooed
Mhm.
and not even investigated. So even things like nicotine, some of the earlier drugs like oxytocin, and there was digestive pancreatic enzyme that they were looking at. There were a number of things that they were looking at, but these were all none of them were patentable drugs, right? They were all repurposed drugs. So they were poo-pooed, right? You have the whole COVID thing all over again. You have to have a brand new drug that we can charge $10,000 a dose for. So there are zero FDA approved drugs for autism. There are, I think, maybe back to one, but there is a drug approved for the agitation associated with autism, and basically it's an antipsychotic, right? And so antipsychotics then, cause weight gain and type 2 diabetes, and then you've got 10-year-olds with autism that are diabetic. So there is no treatment. All they have is behavioral therapy. Again, as long as you look at autism as a psychiatric illness, then the only solution is therapy, right? So as we now know with most psychiatric illnesses, there's a biochemical basis for the disease, right? And so, and anybody who argues with me, I'm going to say, then why do you use drugs? Drugs don't resolve your childhood traumas, right? They change your biochemistry. That's what they do. So we now know that most autism is brain inflammation. It's based on this idea, not just inflammation of the brain, but autoimmune encephalitis. Now, if you get rid of the diagnosis autism and you call this group of kids, about 65% of kids that have autism, you call them autoimmune encephalitis. Now you have a biochemical neurologic disorder, not a psychiatric disorder. And now you have things you can do to treat it. Now, again, in the world of medicine, what do we got? Nothing. All right. So we have to go with, all right, why is this immune system overactive? All right, well, what goes along with autism? Gut problems. I mean, from the original paper, gut problems. 80% of kids have gut problems. What kind of gut problems do they have? Well, most of them have an overgrowth of Clostridia. They have too many fermenting bacteria. 20 to 30% of them have an overgrowth of yeast. Those are the kids waking up 2 o'clock in the morning, giggling in their bedroom. They're not upset. They sound drunk. They have yeast, right? And the yeast is fermenting and creating compounds that are similar to alcohol and makes them drunk, right?
Mhm.
So, we know that the gut issues are there. Well, if you got somebody that has an autoimmune disorder and you're a functional medicine integrative doctor, what's the first thing you're going to think about in terms of how can I manipulate that immune system, right? That's where most of the immune system lives. That's where most of the environment immune interactions happen, are in the gut and the mucous membranes. You got a problem there that is associated with this problem here that we call autism. Let's treat this and see what happens, right? And so a big part of what we do is do microbiome evaluation and then change it. You look at things like gluten casein-free diet. They've done a lot of studies now, and they're pretty much divided right down the center. Do they help or do they not help? It's 50-50. Half the studies say yes, half the studies say no. Interesting thing is, even in the studies that say no, the parents keep their kids on the gluten casein-free diet because the parents thought they did better. All right. Just didn't measure on their metrics that they used. So, the bottom line is what you eat makes a difference with the gut. And I know there are parents that have completely recovered their kids just through diet. All right. Just by feeding their kids real food, gluten casein free, but real food that's organic, homemade, nothing out of a can or a jar. They made it themselves, get their kids eating it. And it makes a huge difference for them. So we do that. And then we look at, there's testing you can do. We do organic acid testing. We look, do they have a methylation disorder, sulfation disorder? Are they toxic? What do their B vitamins look like? Fatty acids, amino acids, all those things that you can do nutritionally, and you start fixing those things. All right. Initially, you fix them with supplements, but most of the time, if you fix the gut and get the kid eating real food, all of a sudden you don't have to take 20 supplements. You can get nutrition out of the food if it's in there to start out with, and that's back to the don't eat crap principle, right? I mean, if you want to eat bread, okay, eat fresh, homemade bread or a bakery that actually uses real ingredients to make it. That's what you want to eat. Don't go to a grocery store and buy something in a bag that's soft and gushy. That's garbage.
Right.
There's no nutrition in that. And whatever nutrition is in there, they add it in,
Right.
right? They added vitamins. Those are all the things you can't read on the label. Oh, that's B6. Oh, that's B5. Oh, that's B1. They have to add it in because they took all the nutrition out of the grains,
Yes.
right? Another seed, by the way. So
When you say gluten free and casein free, can you give, I mean, obviously the gluten is the breads, the grains, but with casein, that's obviously dairy. Is there
yeah,
any
there,
other?
yeah, dairy has a couple of really big proteins. So one is casein and one is whey. You can be sensitive to either or both. I happen to be sensitive to whey and not gluten, and not casein. Other people, it's the other way around. So when you make cheese, you precipitate the casein out of the milk. All right. So curds and whey, curds are what you make cheese out of. That's casein. Right. So cheese is very, very high in casein. So if you have a casein sensitivity, cheese is not the thing you want to eat. Right. But a lot of kids have on the spectrum have casein sensitivity. And then there's all these problems. It's the same with gluten. I can't eat gluten in the United States. I can eat gluten in Europe because it's a different gluten, right? I can sit down in anywhere in Europe and have a croissant or a fresh piece of bread. Doesn't bother me. Here I can't do that. I mean, I will get like inflammation. I'll gain like 3, 4 pounds in a day from the inflammation from the gluten I just ate. So, again, a lot of this is how we modified it, but it's our ability to tolerate that. So again, a lot of these kids have some degree of sensitivity, and this is genetic. There's genetic predispositions for whether you're sensitive to casein or gluten or whatever. And a lot of these kids have those genes. So the same gene that makes you sensitive to gluten specifically makes you susceptible to autoimmune disorders, particularly thyroid, Hashimoto's, to rheumatoid arthritis, to lupus, to those kinds of things, right? So, and celiac is the big one. So, when you have a kid that already has, potentially has autoimmunity, maybe we should be thinking about this. And again, in this day and age, you can check all that stuff, right?
Right.
So we can go in whatever direction we want to go in. There's no cookbook answer
Yeah.
to the chronically ill patient. You know this,
Yeah.
right? It's like, and what happens in autism world is because you have this diagnosis. And I always want to point out to parents, it's autism spectrum, underline that word, disorder, underline that word, meaning we don't know. That's what autism spectrum disorder means. All right. It's like we don't know what causes it. We're causing a spectrum disorder. We're going to take a bunch of kids that have similar symptoms, put them over here, and put a label on them. ASD. That tells you nothing. Right. So, again, the saying in autism world is if you met one kid with autism, you've met one kid with autism.
Right.
But in autism world, all these parents are connected with each other. Oh, he did leucovorin, he did folinic acid, and he recovered his language. And then everybody wants to do leucovorin. Maybe that would help a lot of kids, but it's not going to help everybody. So again, you have to look at the kid sitting in front of you. That's our job, is to figure out, what is going on with this kid, what's common to everybody else that might have the same label, and what's unique.
You know what's interesting is you brought up yeast as one of the markers in the gut, and then you brought up gluten sensitivity. So we see that too in our CIRS population, so the mold illness. So whenever someone has a lot of yeast in their system and they're not eating yeasty foods or foods that feed the yeast, especially if they're eating mostly meat, then we're thinking mold or mold in their environment. And then we also see the people that are highly sensitive to gluten are also the ones that maybe they're just more genetically susceptible to mold illness. We see that. And then of that subset, then we'll see people that also have Hashimoto. So I'm so curious with your children's population, if you see the yeast, they're sensitive to gluten, or you take them off gluten and they do better, do you go down the rabbit hole of mold illness?
Oh, we do. Again, it's always, my approach is always get the history.
Okay.
I
Yeah.
call it your tale of woe. So I listen to the tale of woe, and from that, I'm trying to get clues. No, I've been at it long enough that I know, waking up at night means they have gut problems and that sort of stuff. So you're automatically in your head going, we need this, we need this, we
Yes.
need
Yes.
this. But in terms of my biochemical evaluation, I almost always start with an organic acid test,
Okay.
right? So
Okay.
I'll do an oat, and then when I look at the oat, and people say, "How do you interpret it?" It's like, I don't know. I've been doing it long enough that it's like by osmosis. I hold that test up to my head, and it goes into my brain. But you can look at an oat and just say, "That's a toxic oat."
Yes.
Then I'm going to start worrying about mold. I'm going to start worrying about metals. I'm going to start worrying about environmental toxins. Are they eating crap? Where do you live? There's so many, Michigan is not as industrially as it was 100 years ago, but still a lot of that stuff's buried. We have PFAS from Wolverine Worldwide. We forever, I swear, those people in Detroit, when they had something really toxic, they would put it in a 55-gallon barrel and they would drive it into the north woods of Detroit, outside the Detroit city limits, but up north of Detroit and dig a hole and bury it. And lo and behold, those things are coming back to life 100 years later. Just all these toxins. I had a patient just last week. I said, because she looked toxic, and it's like, where do you live? And she goes, I live in Ann Arbor. It's like, okay, where in Ann Arbor? There's no real industry in Ann Arbor. There's never been. And she tells me, she goes, this place called Leslie, near Leslie Science Center. I said, Leslie Science Center. I remember that was closed for a while because my kids grew up here and we couldn't go. So I look it up and she goes, "Oh yeah, it's all this land owned by this University of Michigan professor and he donated it and blah blah blah." And I looked it up. Well, it was a chemistry professor who had a lab on the ground and he buried all those chemicals in the 50s, donated all the land to the University of Michigan, and this stuff is coming to the surface. And they had to do like a $500 million cleanup. It was like a brown site, toxic waste dump in the middle of a residential neighborhood in Ann Arbor, and nobody would have known about it.
Right.
Right? I mean, it's like, and this was what happened in Michigan with the PFAS cases. All of a sudden, some bright doctor recognized that the rates of leukemia and lymphoma were out of control in this area. They went and investigated. They found PFAS in the water. It's like, well, how the hell did PFAS get in the water? There's no industry there. Well, there used to be, Wolverine Worldwide. And that stuff went underground and now it's gotten into people's wells. So Ann Arbor water supply comes from the Huron River. We have a dioxin plume that's been slowly making its way to that river. I don't know how much longer it's going to take, but it's going to get there really soon.
Wow.
When it does, all the drinking water is going to be contaminated with dioxins.
There's a movie called The Devil We Know, and it's all about the PFAS and how the Teflon and how they use that certain chemical that now they see it's in everybody's blood
Oh yeah.
and all over the world. And
Mhm.
it is a concern because I never looked at where people lived, but now that we work with people all over the US, when we have their address and let's say they're not getting better with their mold illness and maybe there
Right.
is something else, but we'll look at is there a body of water near you and has there ever been toxins or Listeria or something found in that water that's now you're inhaling it. So it's so interesting how complex chronic illness is. And so that's why when someone says it's just this or just that, I always think usually our bodies are a lot smarter than that just to get
Yeah.
sick by one thing. But
Right.
let's talk about spike protein, long COVID. Do you think long COVID is just all of this chronic illness now proliferated, or is it really a true separate illness?
No, I mean, number one, long COVID, long vax, it's very similar. I mean, the difference between the two is obviously when you get COVID, you make an immune response to the entire virus,
Right.
and you have a certain level of spike, which is one of the things you make antibodies to. With the vaccine, one of the things that we're bragging about is you had much higher levels of antibodies to spike with the vaccine because you have much higher levels of spike, right? So one thing we also know, and this is basic science that you're supposed to get before you ever, create a vaccine or release a virus from the lab. You're supposed to know what are the dynamics. I mean, how long does this thing last in your system? With spike protein, the answer is we don't know. The every study we've done at the end of the study, there were still people that had spike protein, and I think the latest is 3 years. But we don't know how long somebody can have spike protein. So you can actually measure because the spike is usually held by these monocytes, these non-classical monocytes. The purpose of that monocyte is to go in after an infection, clean up the mess, go to the liver, spleen, commit hara-kiri, give up their existence so the liver can process this stuff and get rid of it, right? Detox the stuff. So with COVID, with that spike, when it picks up the spike, it no longer goes through that apoptosis process. It doesn't die. And it just continues to circulate. So as long as it's circulating, it's stimulating the immune system, and you have this chronic inflammatory response. So how long does that last? Well, the thought was as long as that monocyte lasts. Well, monocytes really shouldn't last more than 6 months, 2 years at most. So why do we have people 3 years that still have spike? Are they still making it? So then that brings up this whole idea of, did something happen with the vaccine? Because it's, mRNA. And every cell in our body, well, I shouldn't say that. Many cells in our body have the ability to reverse transcribe. So they can take messenger RNA and transcribe it back into DNA. That's not unique to these RNA viruses. Our cells can do that as well. So is there somehow that we splice that DNA into our system so that now we become the spike factory, that we're actually making spike? Again, these are unknown questions that should have been answered long before anybody released this on the human population. I can tell you, and this was the discussion that we had when I did my presentation. One thing is you have spike and you have persistent spike. There's some question about whether the virus itself can persist. The same way that it can with like varicella, chickenpox, or with Epstein-Barr, some of these other viruses. Can the COVID virus persist? And there's some evidence that in the right or wrong person, depending on how you look at it, might. But more importantly is, this persistence of spike. So a lot of people think that's long COVID, but other things that have been labeled long COVID, you have to make sure it's not a reactivation of a chronic whatever. Like, I've had people where we put Lyme to bed, and I'm talking Lyme and Lyme co-infections. We put it to bed, they got COVID or they got the vaccine, and all of a sudden symptoms came back
Yep.
that was mistaken as long COVID, but it's a reactivation of the disease they had before. And then the third leg is it can generate an autoimmune disorder. I mean, other viruses can do it, COVID can do it, and certainly the COVID vaccine can do it. And if you have an autoimmune disorder and you think it's long COVID, you're not going to be treating it the right way. So you have to see what category they're in. Spike is, I'm not saying that's easy. Spike is difficult to get rid of. We have some tools, but again, how well do they work? And part of the problem is these people that develop this small fiber neuropathy, not just from the COVID vaccine, but from a lot of vaccines, not recognized because it takes a while for it to develop, like years, but they develop a small fiber neuropathy. Once you've damaged those nerves, I don't know how to repair them, right? So I can stop the process, but that doesn't necessarily make them better. And that's kind of scary.
So how do you approach it? It sounds like you're saying figure out what it is that's persisting, whether it's the actual virus, the antibody production, or the spike protein production. I had Dr. McCullough, and he brought up that the spike protein, if you got vaccinated, it could basically recreate itself, and so it never goes
I think,
away.
yeah, I think so.
Okay.
I think there's some evidence there. I'm not 100% convinced, but I think so. But yeah,
Okay.
and then you have to differentiate that from
Other illnesses, which we've seen a lot of autoimmune get exacerbated, cancers come back
right,
and they become super cancers. And then there's just other illnesses, or I've never felt the same ever since COVID or getting the COVID vaccine. So there's a lot of that as well. And
right.
so it's parsing all of that out. But
Mhm.
is there, yeah, go ahead.
Well, no, I mean, again, there's tools that we all use.
Okay.
Most of us, if there's spike, we'll use ivermectin, we'll use enzymes like lumbrokinase, nattokinase, serrapeptidase, those kinds of enzymes. Taken on an empty stomach, they can help break things down. I am not beyond using prescriptive anticoagulants, because they help. And it's, again, I do, what's his name? Bruce Patterson. He has a panel, right? A long haul panel that's 14 different markers. So based on that, you can see, do they have, platelet activation? Do they have a high TNF alpha, that sort of thing? So initially, all those things were elevated. What I'm seeing more and more now, people are sick for 3 years with this stuff. What I'm seeing more now is everything's low. They
Okay.
don't have high cytokines, they have no cytokines,
Right, right,
right? So, it looks like an immune system is just burned out,
right.
right? So that's even harder to treat because you need that immune system for them to get better, right? So now you're going back to the gut and, what can you do about that? And then are there things you can use to stimulate the immune system. Now we're going to, more the cancer treatment side of things, in holistic world, it's like, can we use things like mistletoe extract? Can we use some of the things, the mushroom extracts, the things that we use in cancer to try and boost the immune system, boost the killer cells, and especially the cytotoxic T cells? Because again, you can measure all this stuff, right? So is that what they have? Well, we can do something about that. And then again, Patterson was big on Maraviroc and statins. I always like to say I hate statins. I have written more statin scripts in the last 3 years since COVID than I have in my entire career, right? Combined, because I just, I mean, the numbers, they prevent heart attacks, 30 or 40% reduction, and you live 2 days longer if you take them
Right.
for 30 years. It's like, what a great drug. So, it is not ideal, but if it's helped some people, right? So I'm looking at that. And then obviously anything that's anti-inflammatory, anything that tries to shut down that chronic process. But the bottom line is you got to convince those non-classical monocytes to give up the ghost.
Okay.
How do you induce apoptosis in a white blood cell? I mean, that's the last thing we were taught or ever even thought about, particularly as integrative practitioners, because we're just trying to get that immune system to do its thing,
Working, right.
right?
So I just want to clarify because I don't think everyone knows Bruce Patterson's statin therapy. It almost sounds like you're using it for cholesterol, but
Oh,
I just wanted, yeah, if you want to do a quick
yeah.
explanation
So
of
the
how, for
idea,
some reason, statin works on long COVID, yeah, if you
yeah,
want to just
yeah.
give that.
So Bruce Patterson was a researcher from California. I don't
I
care.
don't know where he's from.
Stanford or UCSF or one of
Okay.
those, but in the San Francisco area. So he was an HIV researcher and he sort of branched off, started his own lab. He was looking for better testing for HIV, and then COVID came along. And of course, during COVID, everybody became a COVID expert. So he was looking, can I come up with a profile? If somebody shows up at your doorstep, can I come up with a profile that will determine they're going to end up in your ICU or they're going to do fine? So that was the original panel that he created. And, artificial intelligence, what do they call it? Machine learning, that's AI. He did hundreds of markers and then fed them into the AI and said which one of these correlate. And it came up with 14 of them. And that's what his panel is. And then when long COVID showed up, which was in September of 2020, we already knew there was long COVID. So he showed that that was a different answers on that profile. And then with the vaccine, people that had a problem with vaccine, that was another different profile. And then he's expanded it to say Lyme has a different profile, mold illness has a different profile, Epstein-Barr has a different profile. So you can use his profile. It's called a long haul panel, but I use it on anybody that has immune activation. And you can order it. Radiance Labs is the lab that actually does the testing. So Patterson also said the reason why people are sick is because those non-classical monocytes won't give up the spike. So he has a second profile where you can actually measure the monocytes and whether or not they have spike in them. So you can say how many classical versus non-classical monocytes and what percentage of those have spike in them. And then he also did a study where he used Maraviroc and a statin drug. I think he used simvastatin, but he used that combination. Maraviroc is an HIV drug, and then a statin drug, cholesterol drug. And he used that combination because he said that would flip the switch back to get those non-classical monocytes to go through apoptosis and give up their payload to the liver. All right. So he had some success with that. Again, things are in evolution. There's a big difference between somebody who had long COVID for 6 months and somebody who's had long COVID for 3 or 4 years.
Okay.
Right? I just think the immune system burns out.
And so, in some instances with the long COVID, depending on the test panel, the person in front of you, you may then prescribe statin, not for cholesterol, reducing the 1%
Yeah,
or the two
right.
days of
Yeah,
living longer, but because of the
right. And hopefully we're not prescribing this for the rest of their life. I mean, that's the problem with statin drugs, right? You're not taking it, it's not like an antibiotic where you're going to take it for a week, 10 days, if it's Lyme for 30 days or
right,
60 days,
right,
whatever. But, you're taking it for a prescribed amount of, most statin drugs, you're taking it forever. But
right,
here you're taking it for a prescribed amount of time. We do a month trial, a 3 month trial, a 6 month trial. We're not doing them forever. And with that, the benefit of that kind of short-term treatment is going to outweigh the negative. But again,
right,
if you're trying to prevent a heart attack, you got to take it every day for the rest of your life, right? And then the toxicity of the drug meets or exceeds the benefit of the drug, which is why
right,
most of these drugs do not make us live longer.
right. Of all your population of patients you've worked with, Do you generally recommend vaccines? Any of them? I know it's a hard question, but I'm curious. I asked a couple of the doctors, like, if now that you know everything you know, and we've done
No,
this side research, you wouldn't?
no, I once did a interview on the Vax Bus with Polly Tomy. I didn't think anybody was going to see it, so I said, "Fine." That was when I finally got. I was just tired. I was fed up. I said, "I'm not going to pull my punches anymore. Whatever question she asks, I'm going to answer, and I'm going to answer with my truth." So her last question is, Dr. New, here's this newborn baby, yours to care for. Your responsibility. What vaccines would you give this baby? And my answer was, none of them. I don't think any of them are worth the risk. And if you find one, please let me know.
Okay.
All right. That's how we ended the interview. So I don't think, when you investigate either the risk of the disease or the toxicity of the disease, most of the vaccines we use are ridiculous, right? They're not deadly diseases. Measles was never a deadly disease until we made it one,
Right.
right? I mean, everybody got measles when I was a kid. It was a rite of passage. And then the same thing with chickenpox.
Yes.
Prior to the vaccine, everybody got chickenpox when they were young and they could handle it and it didn't kill anybody,
Right.
right? They were not toxic diseases. And you can even go to polio, right? Because I mean, previously people got polio when they were born and they never had the disease polio. They carried the virus in their gut,
Right.
but it never became invasive and destroying their immune system, right? So, us meddling with the environments created these problems. So I don't know of any of these vaccines that make sense. So either the disease itself is not a problem, or it's potentially a problem. Okay, we'll call polio potentially a problem, but it doesn't exist. And you can say, well, polio doesn't exist because of the vaccine. And my answer would be, yeah, the oral vaccine, which we stopped using in the 90s. All right. The polio shot does not prevent you from getting the virus. Just like every other viral vaccine that's not a live virus, you will get infected with the virus if you're exposed to it. So we're vaccinating for a ghost. Take your smallpox vaccine, same idea. All right. Then you have things like meningitis, scary disease, but rate of meningitis is 1 in 40,000. The rate of dying of meningitis is 1 in 80,000. And for that, we vaccinate every single person multiple times. Right. So is that worth the risk? The answer is we don't know. Why? Because they won't tell us what the toxicity of the vaccine is. Right.
But what we do know right now, and even in pet care, so we just got a new dog. And 20 years ago, when I had a dog, the vaccine schedule was so different than it is today.
Yeah.
And I just don't understand why we're having to vaccinate every year. I saw that if I don't get the rabies shot for my dog, it's a misdemeanor in Texas. I was like, wow, I got to take that pretty seriously. But it's again, you see whether it's in our pets or humans, we are getting sicker than ever, and yet we know the diet is less than ideal, and then the shots are less than ideal. So they must have some play, and it's not just in humans. The dog, I've seen that the rate of dogs dying earlier is much higher, and they also get cancers and autoimmune, and it's all of the things that
Yeah.
us humans are getting too. And so again, like what are the similarities that we've done in
Well,
human health
no,
and dog pet health? And it's very similar and scary.
no, absolutely. We feed our dogs crap. Sorry, but we do.
And we
And,
vaccinate them a lot.
and we
We
vaccinate
vaccinate them a
crap.
lot now. And it doesn't matter if the dog is a 100-pound dog or a 5 pound, the
Yeah.
shot dose is the same because they say it's all it is an immune response. So it doesn't matter. But I really think the dose actually does impact. But I mean, I'll save that for another day. So for children that say that somebody's watching this, that their child is struggling with autism, what are your first heavy hitters that you would say try to do with your child?
Well, I mean, number one, try the diet. At
Okay.
least gluten-free, because some of these kids are sensitive to gluten, but most people would say gluten and casein-free
Okay.
that you can do on your own. I always tell parents if you're worried about, oh, they're not going to eat, blah, 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 feed them real food. Just get real food, get rid of all the garbage, get rid of everything packaged, get rid of all the sugars, get rid of all that stuff. They won't eat. No, they will eat.
Yes,
It's
they will.
just they're addicted to this stuff.
Yeah.
For a heroin addict, it's going to take them 4 to 5 days to get over it, and they'll start eating. The trouble is most parents will last about 12 hours. They'll give
Right.
in long before the kid does.
Totally.
So, but part of it is get them on real food, all right? Because that's something they have to eat. Might as well feed them good food. The second thing is if you can find a doctor to work with, there about 70% of kids, especially the non-speakers, respond well to high doses of folinic, not folic, but folinic acid, which the brand name is leucovorin. It's a prescription, and typically we're trying to shoot for about a milligram, 1,000 micrograms per kilo of body weight. So these are very large doses. But that can make a huge difference for these kids. The third thing are fatty acids, particularly the omega 3s, the EPA, DHA type omega 3s. They seem to make a big difference for these kids as well because they're anti-inflammatory and that sort of stuff. And then the other thing I say is find a MAPS doctor. The Medical Academy of Pediatric Special Needs, medmaps.org, go there, find a MAPS doctor because, you really want to give your kid as much benefit as they possibly can, as early as they possibly can. I'm a fan of ABA therapy early on. Beyond 5, 6, 7 years old, not so much. All right. Because the kids have sort of developed intellectually beyond what they're doing. And then the final thing is, if you've got an older kid and he's a non-speaker, look into some of these spelling programs. They make a huge difference in the life of that child. So whether it's spellers or it's the spelling to communicate, there's a few different organizations out there that makes a huge difference for these kids. And so it's not just about, curing their autism. It's about what can you do in the confines of what you have. But the earlier we start, the more aggressive you are with it, the better outcomes you get later on. There's a cause for this, right? And we should be investing billions of dollars into it. The only thing you can get funding for is genetics. That's it. All right. If you want to go in and say, I want to work on, improving the gut in autism, you won't get funding. Well, maybe you will now, but you couldn't get funding.
Oh, it's unfortunate. But I mean, people like you are making shifts so that parents and families have answers because I feel like we should always fight for root cause and get answers instead of let's do this med or do this or, take out I think red dye is another one that I've heard a lot of the parents bring up, but there has to be more. And I feel that until we get answers, then we have to do these small grassroots movements. So thank you so much. I will put all of your information in the show notes. Do you work with patients still and where can people find you and where can you find the MAPS doctors?
Yeah, so the maps is easy. It's MED,
Okay.
medmaps.org. So we keep a up-to-date directory, whatever level of training somebody's had, it's all
Okay.
in that directory. And then for me personally, I mean, my practice is called Bioenergy Medical Center. So it's just bioenergymedicalcenter.com is my website. We have a Facebook page and that stuff. I'm not on social media. So if
I'll
you
do
look
it. I'll put in the show notes.
you will not find me. Or if you find me, congratulations, you did some detective work because I am out there, but you won't. I'm not designed to be found. Those are the two big sources. The whole thing is finding a practitioner that does what I do. I'm busy enough. I've got a 6 month waiting list. I have nurse
Okay.
practitioners that work with me. We're more than happy to see patients that come through. But we didn't invent this, and we're not the only ones doing this stuff. There's lots of good functional medicine practitioners that understand the root causes of illness, and that's who you want to see. I'm obviously very biased towards MAPS doctors because I'm teaching them, and so I know that they get the underlying principles. And, whether it's MAPS or somebody's been to A4M or they've been to IFM or they've been to any of these, they just have some basic principles of understanding of what actually causes chronic disease. And then you can put whatever label you want on that chronic disease, whether it's autism or mold or Lyme or, long COVID or whatever you want to call it. At the end of the day, they all have similar underlying
Right.
causes. And that's your job. And again, I always wonder how many of these people with long COVID, the issue is that they're fundamentally toxic, that they were toxic before they ever got the injection or before they ever got COVID.
Yeah, and if they just had somebody or someone that could tell them, hey, you're probably not the candidate to get the shot because your immune system already looks a little weak,
Yep.
that would have
Well,
been
again,
so
we wish,
nice.
yeah, no, we wish that they would do that kind of research. Gregory Polland tried to do that about, I don't know, 15 years ago, and what did he call it? Reactogenomics or something like that. I mean, it was just this idea of can you genetically determine who's going to be at risk for having an adverse reaction? And he got shut down. He shut himself down
Oh.
because they started attacking him. He's like, I'm not anti-vax, right? And so he basically stepped way back from his research and nobody followed up. That's what I was talking about in the beginning, right? You can't do any research into
any chink in the armor of vaccines are safe and effective. If you do anything to say that there's a group over here that's susceptible to injury, then you're admitting that vaccines injure people.
Right, right.
Can't do that. Can't do
Of course.
that. So why would you spend research money investigating something that just isn't a problem to start out with? That's where we're at.
Right. Well, the blessing in disguise with all of the COVID stuff, I think, is it woke up many people, many parents of, well, if there were certain injuries, assuming from the COVID vaccine or from something around that area, then maybe this also affects children vaccines. And I saw this one study. I don't know if it was based out of Michigan, but they showed that a lot of parents, just because COVID happened, they didn't take their children to get the baby shots.
Mhm.
And the survival rate of infants during that time went up.
Yes, SIDS went down, survival went up. Yep.
Yes. And it's, wait, what? So the kids didn't, so these babies didn't get their routine vaccine shots and infant mortality dropped. So
Yep.
less babies died.
Yep.
And that study was published. I'll put it in the notes, but it's
Yep.
something to think about. It's something to think about. Even though they didn't research it, they did show the numbers. And so it's pretty telling. But
Yep.
thank you so much for your time. I will put everything in the show notes. And again, thank you for being an advocate for something that's not always the easiest to talk about, but I appreciate you so much.
Well, thank you. I appreciate the work you're doing too.
Okay. Thank you, Dr. New. Okay, guys, I hope that you enjoyed this conversation. Dr. New is so fun. He is so honest and so real, and he shares honest tools and tips and practical things that he has seen that has helped people get closer to root cause healing. As you can see, there is no one trick answer or one trick pony that will get you healed. Some people, it might take just diet alone. Some people, it might take just taking gluten out alone. But oftentimes, especially the toxic soup we live in, it takes many different levers. And in working with someone or in finding answers, you can figure out which lever to pull first. Sometimes or oftentimes it's a mix of many things. And so I hope that if you are going down, it is just seed oils and I need to remove all seed oils, or it is just food dyes and I need to remove all food dyes, or it is just the light in my house and I need to change all my LED lights. All of those things have a play in your toxin bucket, but we rarely ever, probably never, see that those one things are the answer for everyone's root cause illness. It is also why in our practice we never say it is the one spice you leave in for a carnivore that is making you sick. It is the one small onion you leave in. Yes, onions can be toxic. It's toxic for dogs, but it can be toxic for a certain person, but usually it is not the onion that made your whole body toxic. And that is why we always recommend getting to root cause. And sometimes it's more than just this one particular thing. Dr. New also has a newsletter that he shares occasionally where he talks about a topic. The other day, he was talking about osteoporosis. So make sure to check out his newsletter. I will put all the information about MAPS if you are having or know someone that is suffering from autism. It's a prevalent illness. 1 in 31 kids now have it. I suspect it's a lot more than that, since if the data is from 2014, there is 10 more years plus a COVID virus that has come out since then. So, how much more are we suffering from this illness and not having more ideal answers or root cause answers for it? I think it's more than just behavioral therapy. Yes, we can use that. We can use speech therapy, but there should also be more in terms of getting the immune system stronger. If autism is in fact an area of brain inflammation, then let's find ways to reduce the inflammation. One easy way is a animal-based diet, but then beyond that, it's figuring out what else can we do to support the immune system. And one other way is the gut, which of course the carnivore diet also supports. Okay, guys, I hope that this information helps you, gives you things to think about, and more than anything, helps you to understand how we have so much toxicity around us. And in supporting our mind, body, and our spirit, we can do so much. It is the way that we have to be guarded or suited up when dealing with this toxic world. Okay, guys, make sure to eat a lot of meat. Take care of your bodies because it is the only place you have to live. I will talk to you later. Bye, guys.